A lot of people cannot afford nursing homes. The whole point when you get old, basically, is to deplete your savings into long-term care. If you do not have somebody who can take care of you, if you don't have family you can live with and help them and they help take care of you, if you don't have those resources, you are in for a very rude awakening for what the long-term care system is like in this country. So yeah, if you can't afford 6,000 a month, doesn't mean you automatically get Medicaid. You don't qualify for Medicaid, and it varies state by state, but for the most part, if you have more than 2 or $3,000 in savings, you don't qualify. I mean, you have to be very, very poor to qualify for Medicaid. So what happens is you need to deplete your savings, you need to get rid of your assets. All of this stuff will go towards your long-term care. And then when you finally have gotten rid of all of it, you have nothing. Then you can get Medicaid. But Medicaid is what holds this whole system up. Because if you don't have any money and you need care, there will be no one to take care of you without Medicaid. It is instrumental. And if you have not had to care for somebody who is old and infirmed, and if you and is needs an extra level of care, or somebody who is very sick or needs specialized care, if you haven't had to navigate that world yet, look out, because it is so ugly. And the state of our healthcare in this country is terrible. And it is barely clinging on with Medicaid. Without Medicaid, it is going to collapse.
The bill that the Republican House just passed, that Trump endorsed, calls for $880 billion in cuts to, it's like the House Energy Committee or something. In any case, it's Medicaid. Medicaid falls under its jurisdiction. Do you know what the budget for Medicaid is in the 2025 fiscal year? It's $880 billion. Do you know who Medicaid helps? It doesn't just help, like I've described a lot how I see it in long-term care, but it helps people with disabilities. It helps pregnant women. It helps foster kids. It helps kids with lifetime conditions. It helps people who are very, very poor and need medical care. It helps so many people, and it's such an important aspect of our healthcare system. And I don't know how you're going to find that amount of cuts. That is basically decimating its budget. When Trump says they're looking for cuts, we don't know that they're looking for cuts. It sounds like they're just trying to gut the hell out of it, because that's what it will do. And I can assure you that anybody that's receiving Medicaid, nobody is living a high roller life. Do yourself a favor before you leave these stupid comments. Go to a Medicaid run facility. Just go and check it out. Just go walk through the doors and tell me your first thoughts. You will be amazed at the terrible conditions that they are in. There's no nice Medicaid facility. They are not well funded, and they have huge wait lists for people that are trying to get in there into their facilities that are approved for Medicaid. There is not, I'm sure there's fraud everywhere, I'm sure, but there is not $880 billion in fraud. This is what Trump signed off on. This is what the president, who you said would agree to not cut Medicaid, is exactly what he's doing. That's exactly what he's doing. The way you guys just take Trump at his word, it blows my mind. He's a pathological liar. He has been all along. It's proven multiple times, and yet you still believe him. Trump said he's not cutting Medicaid, so he must not be. Yet, oh look, Medicaid is getting cut. You guys blow my mind. I'm going to go walk my dog now.
What do you think happens to people who are, maybe they're older or just don't have any money? I'm a hospice nurse, so when people come onto hospice and they don't have people to take care of them and they don't have resources, what happens when they can't take care of themselves anymore? Do you think they can afford nursing facilities? Those are like $10,000 a month at a minimum. So what do we do with them? Do we throw them out on the street and say, take care of yourself? No, we get them Medicaid. We get them Medicaid, and then they can go into a facility that accepts Medicaid patients, and these are usually not very nice facilities. They don't have a lot of funding, but they provide us a very important service. They take care of people when they can no longer take care of themselves. And the idea with this new Republican budget of gutting $880 million billion dollars from Medicaid would be devastating to the long-term care community. I don't think you realize the service that Medicaid provides to people. I mean, it is for people. You have to be very broke. And don't, when you say things like, oh, well, government handouts, like some people are broke. It's a cycle that's hard to get out of. So don't be too judgmental on people that need Medicaid. They are dire. They need that. Everybody deserves to have medical care, even if you don't have money. And Medicaid is how we bridge that gap.
This commenter is right. Medicare does not pay for any sort of housing. So though you may be 65, you may think, oh, cool, then I'll be able to get into some sort of skilled nursing facility if I need that. No, that does not mean that. Medicare does not cover housing. Medicaid does. And how do you qualify for Medicaid? You have to make you have to have less than $2,000 or $3,000 in savings, and you have to drain your assets, and then you can get Medicaid. I'm kind of glad this conversation is starting, because I don't think people realize how utterly awful the long-term care is in this country and the healthcare system in general. I mean, it's quite dire. And we are here needling the programs that need money the most. In the meantime, we have CEOs of corporations, of healthcare corporations, making hundreds of billions of dollars. And we are giving them tax breaks. We are giving them tax breaks, and we're gutting Medicaid. If that doesn't outrage you, I think you have a black soul. I cannot believe that we are here and we are doing this, and people think this is okay.